Hello and welcome to the World Health Assembly here in Geneva, Switzerland. I'm Eric Porterfield with the United Nations Foundation. Today we're going to be talking about one of the priorities this week, universal health coverage, which will be one of the foundations for achieving the health targets of the Sustainable Development Goals. A core element to achieving the universal health coverage will be expanding access to primary health care. This has been a particular focus of the Bill and Melinda Gates Foundation, and joining me today is Dana Hovig, the Director of Integrated Delivery at the Bill and Melinda Gates Foundation. Thank you for joining us.
Thank you, Eric.
Why is this such a priority issue for the Bill and Melinda Gates Foundation?
Yeah, thanks, Eric. First of all, the foundation is actually pretty new to primary healthcare system strengthening. We've sort of made it an emergent priority the last 2 or 3 years. Our leadership has understood increasingly that primary healthcare really helps HIV/AIDS, it helps family planning, it helps increase vaccination coverage, it helps increase safe deliveries and decrease maternal mortality. So primary healthcare is important for the specific disease areas and specific prevention and promotion areas that we and others care about. We also recognize that primary healthcare is a great way and a great start to get to universal health coverage, a destination that we all agree on. But in the dialogue about universal health coverage, we agree on the destination, but there is sometimes disagreement on where to start. And we believe at the foundation that primary health care for many, if not most countries, is the best place to start on your journey towards universal health coverage.
Margaret Chan recently said universal health coverage based on a strong primary care is the best thing we can do. What does that look like? What does a strong primary health care system look like?
So primary health care is something that we in the United States or in Europe take for granted often. It's the first call that we make when our child is sick or when our child has a fever. It's a great source of comfort to know that somebody on the other end of that phone call or to a doctor's visit is going to be able to reassure us that our child is going to be okay. Primary healthcare is the first point of contact with a health system, and yet there's about 400 million people around the world who don't have a reliable first point of contact, who don't have a reliable place to go for primary healthcare. So we believe that primary healthcare is a great place to start for universal health coverage because it provides an essential package of health services for malaria, for TB, for HIV/AIDS, for immunization, for family planning, that all people need in their daily lives and that all people deserve on their way to better health and better well-being.
Great. And where are you seeing this work, and what lessons are you seeing from countries?
We've seen that countries that have focused on primary health care have really accelerated towards achievement of the MDGs in health and are continuing to accelerate on their way to achieving the SDGs. Places like Costa Rica, Turkey, Thailand, Ethiopia, Rwanda have all made major improvements in primary health care, have pivoted their domestic financing towards a focus on population health, on prevention, on promotion, on primary health care, all the elements of primary health care. And as a result, they've lifted up the health of their entire populations rather than just the health of a few people in urban centers close to a hospital. And as a result, those countries are much better off by their focus on primary health care.
What are the steps countries should do if they want to prioritize primary health care?
So we recommend a couple things. First of all, we recommend an increased financing for primary health care. Sadly, around 3/4 of domestic spending in too many countries is spent on tertiary care or secondary care, and only 1/4 or less of the money is spent on primary health care, on basic essential health services for poor people. And we believe that increasing domestic financing for primary health care is a first and great place to start as countries move on their journey towards universal health coverage. The second thing that we recommend is learning from the countries I just mentioned and so many other countries about best practices in primary health care. We, with WHO and the World Bank, have launched the Primary Healthcare Performance Initiative, PHCPI, which has a website with a lot of best practices from around the world on what works for primary health care and how to integrate primary health care within your larger health system and provide integrative care services. So learning from others and increasing domestic financing for primary health care we think are great ways to start on the way towards universal health coverage.
Great. Thank you for joining us today. Thanks for your dedication and passion on this issue, and we look forward to learning more.
Thank you, Eric.